Hello all, my name is Ragini Dalia and I'm a senior sub-editor at She the People TV. Welcome to yet another edition of Women's Writers Fest. Today we will be talking about AI and if it could pave way for women's health. Women may comprise half the world's population, but research on major conditions affecting their health has long lagged that of men. However, with the advent of AI, are we ready to fill that gap? What does the future hold like? To talk about this, we have esteemed medical professionals today on our panel. First up is Dr. Anjali Malpani, who is a pioneer in the field of fertility treatments in India. Her book, Tries, Sighs, and Lullabies, The Untold Stories of Infertility, Dr. Malpani chronicles some of the most intimate and real life stories of love, hope, and endurance. We are honored to have you here on the panel. I would like to start with Dr. Malpani. Uh, there's a survey, a recent survey conducted by Google and Northwestern University, said that AI may be the key in solving women's health issues. And as a person who has started uh, first IVF clinic, first who you brought tech to the fertility treatments in India. So tell us what are your thoughts on AI?
Right. Now, artificial intelligence or AI is obviously the buzzword today. It's used in every field, and it's very exciting that it's come to medicine too. Now,
Yeah.
I'm an infertility specialist, so actually, it's very interesting because there are lots of applications that we can use in my practice. For example, now it is a new frontier, and actually, it can change a lot of decision making that we do all the time in our IVF processes. So basically, it's not a panacea to solve the infertility problem. It's not going
Right.
to solve anything or it's not going to treat anything, but it's definitely going to help the clinicians and the embryologists to improve the success of IVF. So, in any IVF procedure, there are two main doctors. One is the clinician, and the other is the embryologist. So, there are different ways it can help both of them. So, for
Right.
example, the embryologist is the key person who's the heart in the embryology lab. He's the main person who takes several decisions on hourly basis. For example, today we have a human being that's an embryologist looking at embryos every few hours, where he has to go into the lab physically, check the embryos. He's got to take out the embryos, check them, or take the images, video them, and probably see them. But today,
Yeah.
artificial intelligence, in fact, some of us are already using it. It's not something brand new for us. There's something called real time images where we are taking, continuous videos and photographies of the embryos in the lab. And then with a whole lot of embryos, we can actually grade these embryos. Now, grading these embryos is very important because the best of the embryos have to be transferred. And, so the AI can actually help the embryologist to make decisions whether the embryo can be transferred or whether it can be frozen. So this is actually very, very exciting because, it can actually help us in the success. Similarly, these are about embryos. The embryologists can use them to select the best sperm. Now, the best sperms are typically, it's difficult sometimes in patients with severe oligoasthenospermia. That means that very low counts, low motility. Sometimes where we are doing testicle extraction of sperms, where people are azoospermic, or sometimes where the morphology is poor, like the teratozoospermic patients. So this is all exciting fields there again. And for the
Right.
clinician, the AI can actually help in decision making and personalize the treatment because the clinician is making decisions all the time. So that's where I think it's an exciting field, and it can really change the success.
In your book, The Untold Stories of Infertility, you shared some nuanced details on how patriarchy takes a huge role in shaping the discourse around infertility. Do you believe we may help, like may AI may help in normalizing this discussion around having infertility treatments, or are we still looking at that gap? Are we still not able to have a proper normal conversation with our families about IVF treatments?
Yeah, AI has nothing to do with infertility and the emotions, unfortunately. Like, it's just about machine learning and putting in data, getting, the results
Mhm.
out. That's it. But infertility, that's what I'm trying to say in the book, that infertility is not even about medical procedures or just a medical condition. It's very much an emotional one. And that is what is being ignored all the time. So doctors are just focusing on advances, on treatments. And of course, I'm excited about artificial intelligence and how it can improve the success. But unfortunately, I don't think yet that AI is going to have emotions, feel the emotions of the person. In an infertility treatment, it's such a roller coaster of emotions. They go through so much emotional turmoil. For example, just give an example, there's so many emotions involved. A typical emotion is that of sadness, depression. They begin with that. Then there's anger. They're angry with themselves. They're angry with God. They're angry with their partners. Then there's guilt. You feel guilty about practically everything you do when you did, when you were a teenager or was in childhood, or what you're doing. Then there's blaming. You're blaming your partners. You're blaming your mother-in-law. You're blaming everybody. And there's so much of, grief, so much of suffering. So unfortunately, AI is not going to be helping with the emotional angle. I do hope that these avatars, the AI avatars, what they say, may be able to manage in a particular way. And of course, that is another angle of it, because today doctors don't have time to sit and listen. So we have counselors, we have psychologists, we have psychiatrists, but today we also have what is called the AI generated avatar. In fact, I have one on my website, which is drmalpani.com or ivfindia.com. So because it was very hard, we're getting so many messages on WhatsApp, it's very hard to counsel everybody. So we have this avatar who comes in and actually chats with the patient on a chat bot. So, but that's the limitation. You can only ask certain number of questions. The
Yeah.
actual treatments have to be done by the doctor or the counselor. The actual emotional treatments, I would say.
Yeah, yeah. That's maybe a relieving thing to hear about. Dr. Malpani, you have been in the industry for almost over 20 years.
30 years, 33 years.
13 years. Oh my God. So you do have, your journey has been really remarkable in many ways. Uh, do you see that? Do you see we still have a long way to go when it comes to women in STEM, in science, and in medicine? Or
Yeah, things have definitely changed over the last 30 years. But I feel what, just now Priya said was absolutely true, that there is a big gap. And in fact, to give some statistics, I think the total number of girls in STEM is just about 28%, which is really low. I think India has the most number of girls entering STEM, which is 43%, which I think is brilliant, versus US, which is just about 34%, UK is about 38%, Germany is 27%. So in fact, I think I'm really proud to say that India is doing better at these things. But yes, there's a big gap. And I feel the reasons are very obvious, like there's gender bias, there's discrimination, there are these social expectations, norms, women are yet stuck. Obviously, we have to have children, the childbearing is the onus of the woman, but men yet don't pitch in as much as they do, though they do say, yes, we do half the work. We all know that men or husbands don't really do half the work. It's always the woman who's, looking after the house, after the children. And lots of things have to be changed. The perception has to be changed. Basically, we're teaching girls, okay, fine, you're a girl, you need to do this. So all, it has to start from the very early ages. You don't have these kind of stereotype roles anymore. We shouldn't be saying you're a girl, you're a boy. It begins right there. And as you study, of course, things have changed a lot. But I think we have a very long way to go where, equality will be achieved. But yes, we're getting there. So I do hope, I was just going through some of the universities and, what they are doing. So a lot of universities are changing their curriculum because girls find it difficult initially to, like it's a mindset. Oh, the boys are good in maths, the girls are not good in maths. So when you enter, you're always, you have low confidence, there's low self-esteem, especially for engineering, for computer sciences. So what they're doing is actually changing a little bit of curriculum. They're changing the way they're marking the system. they're trying to get peer groups, they're trying to get mentors. So I think all these things are definitely going to help in the future. So let's aim for 50-50 soon.
Yeah, let's look at it that way. Thank you so much for taking time out today and coming forward to discuss about this much discussed topic, much buzzword that's been going around of writing in the age of AI and technology. We really hope for a better future when it comes to gender equality in terms of STEM and so forth. So yeah, thank you so much, and yeah.
Thank you, Ragini. I had a very good session. Thank you.